The Challenge Initiative's business unusual model supports local governments in poor urban areas in implementing effective and lasting interventions for family planning and adolescent and youth sexual and reproductive health. In East Africa, TCI supports local governments in Kenya, Tanzania, and Uganda as they implement high-impact interventions such as the Integrated Family Planning Outreach. An integrated family planning outreach brings health services directly to the community outside of a health facility. The health services are provided at the community level within locally available venues such as schools, social halls, community grounds, and markets. The outreach integrates family planning with other health services such as HIV screening, child immunization, nutrition counseling, and cervical cancer screening to drive more community members to come and perhaps take up family planning while accessing another health service. Increasing access to family planning information and services allows women to make informed decisions on whether and when to have children. In addition to reducing unintended pregnancies and maternal and newborn deaths, family planning can increase educational and economic opportunities for women, thus enhancing their agency to choose a healthier life. How can integrated outreaches help? Integrated outreaches can increase the uptake of family planning or contraceptive services, reduce myths and misconceptions about family planning and contraception, and engage clients more effectively. How do you conduct a successful integrated outreach? The first step is plan. Before you undertake an integrated outreach, you must plan well. Healthcare providers should review community data and indicators like unmet need to identify a site that is easily accessible, has a relatively high population density, and available amenities such as toilets and clean water. A mapping exercise for women and youth can also help determine an ideal location. Remember, resource mobilization should be done well in advance of the planned outreach activities so you have adequate financial resources available. Be sure to have the following on hand: skilled providers, commodities, infrastructure, infection prevention and control, job aids, reporting tools. Next, mobilize. After your outreach is planned, then get to work mobilizing the surrounding communities to come for services. Community health workers or village health teams can help get the word out, as well as promotional materials like posters and brochures. They will also help with counseling and can distribute referral forms and family planning commodities. During health crises such as the current COVID-19 pandemic, remember to support service delivery compatible with physical distancing and personal protection. Have masks on hand for potential clients. The third step is integrate. When planning for your outreach, be sure that the family planning services offered are well integrated with other health services such as HIV, immunization, nutrition counseling, and cancer screenings. It is important to integrate family planning to reduce missed opportunities and make it more convenient for those seeking multiple health services, such as mothers wanting to get their children immunized. Also, youth that may want to seek services are able to access family planning providers without the stigma associated with visiting a public health facility. Integrating services also reduces the overall cost of the outreach. Fourth, ensure quality. Make sure the services provided on the day of your outreach are of the highest quality. County, state, or district management teams should ensure that all staff are appropriately trained. They should also be present to observe and provide supportive supervision on the day of the outreach. The final step for conducting a successful integrated outreach is to monitor and evaluate. Record attendance data for all services offered in the relevant Ministry of Health tools and determine how many new family planning clients were gained. Hold a meeting after the outreach to review any operational or logistical issues to make future integrated outreach activities better. Discuss the results with your team and coach them before preparing to hold the next integrated family planning outreach. Find out more about TCI's integrated outreach approach in TCI University. Visit the TCI website, click on TCI University, then Hub Toolkits. You will find this approach in the East African Toolkit under Services and Supply. TCI thanks all of its local government partners and stakeholders in Kenya, Tanzania, and Uganda working to improve the lives of women and girls living in urban slums. For more information about other TCI high-impact interventions, visit tciurbanhealth.org or talk to your city TCI focal person.